Okay, before you watch this video, I want to make sure that I'm being clear. My message of this video: do your research before getting on any kind of antidepressant medication, SSRI, tricyclide, anything. And I know that this is like a well duh kind of moment. Um Here's the thing, and I mean in-depth research. I did my research. I went online and looked at the withdrawals and the side effects and all that good stuff. That's not the kind of research I'm talking about. I'm talking about visit 20 or 30 different sites. Really understand what are some of those rare side effects? What are some of the more common side effects? Because you may be rare, which I didn't think I was. And actually, come to find out, when you watch this video, you will find that my symptoms are not rare. And actually, my symptoms are much like a lot of what other people experience. We just don't hear a ton about it. Um, but do your research. Go on different sites, multiple different sites, because one site may report dizziness. The other site actually may give you a little bit more detail, like as in vertigo, or when your head tilts to one side, you get dizzy, or whatever. It may give you more detailed info. Um, Jump onto Facebook groups, ask other people their experience. That's the kind of research I'm talking about. So do your research before getting on an antidepressant, any kind of tricyclide, any kind of mood stabilizer, any kind of SSRI. Do your research. Be aware of the side effects, be aware of the withdrawals, and just be prepared. Be prepared. That's my message out of this entire video. So, here we go. Okay, I am back with just a quick update on regards to the Remeron mirtazapine, I believe that's how you say it, withdrawal. So this is a tricyclide antidepressant. And I was on Lexapro Prozac for 4 or 5 years ago, when I went back to college. And I never noticed any withdrawals from those at all whatsoever. Actually, I did really well on the Lexapro. Um, and I think at the time, I was having anxiety, especially going back to college. This time around, I used the Remeron for sleep. And for those of you that don't have a clear picture as to like what's been going on with me, so I think with the stomach issues, I am particularly vulnerable because I just went through about a SIBO that nearly almost killed me. The SIBO infection went unnoticed. Got so bad to where I was only able to ingest liquids. Still went unnoticed. Finally, at the end of January, we got a diagnosis, got on antibiotics. And I say we because my husband's been through this all with me. So it's been a crazy ride. Finally got that knocked out. So I did take a breath test not that long ago, and it is negative. And I do have the food marble. So for those of you that know what that is, I will do a video on that here in a little bit. I have the second edition. So the Remeron antidepressant withdrawal. I started taking Remeron mid-February for sleep, and it did. It knocked me out like right away. I really like that stuff for that purpose. Started having in March, mid-March, started having like significant, maybe it was like end of March, significant stomach cramping. And I didn't know whether this was dysbiosis, recovery from the SIBO, if it was Motegrity, because at the time I was using Motegrity too. But it was just severe stomach cramping, and it was random. One day I would have significant stomach cramping. The next day I would be fine for 2 days, and then I would have stomach cramping. Also started having muscle cramps just randomly all over my body. Back muscle cramps, leg muscle cramps, like prickly skin feeling, or burning skin feeling, dizziness. Couldn't turn to my right side, or like the whole room would go like cattywampus. And at first we thought it was Motegrity, so I went off of that about 3 or 4 weeks ago. Didn't see any change in the symptoms, stomach cramps, all still there. Put our finger on it and said, okay, it's got to be the Remeron. I was on 15 milligrams. I did go cold turkey, but I had only been on it for 2.5 months. So I thought that, oh, the worst of withdrawals would bypass me. 2.5 months is long enough to get withdrawal syndrome. So dropped it. Last week was the week from hell. Significant stomach cramping in my lower stomach, midsection, upper stomach. Very intolerant to foods. Absolutely the worst acid indigestion I have ever had. The worst heartburn. The heartburn was constant. You can hear that my throat, I'm actually still like really hoarse because it's acid reflux. Just significant stomach issues from it. This week, so it took about a week for that to die down, the severe stomach cramping. The upper stomach pain and like a rock constantly feeling like it's in my upper stomach has continued into this week. And so this week, a lot of it is some stomach cramping, some stomach pain, not as severe as it was last week, but just like there is a rock in my upper stomach constantly. And after I eat anything, it feels like it's crawling up into my chest. I feel a tightness, like a band around my chest. The skin tingling and prickling has gone away 90%. So that, I can still feel that, like, in random areas from time to time. It's weird. And I do still have some, like, back spasms going on. But SSRIs, any kind of antidepressant, an SSRI, a tricycloride, these, like, don't play around with these. These have significant withdrawal issues. And so when I first started taking this, I don't think I thought, hey, it's an antidepressant. I've taken one of those before, not a problem. Let's go ahead and put it on board. It's got this added benefit of making my stomach move and making me more hungry, which is awesome because I just went through SIBO and my stomach shut down and blah, 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 blah. I didn't really go through all of the possible withdrawals, side effects, all that good stuff. And I highly suggest, if you are going on an SSRI or a tricycloride, or for whatever reason, it doesn't matter. Mine was for sleep, of all things. Do your research in regards to the withdrawal syndrome. Know what you are coming up against. And talk to your doctor about tapering, because that can help a lot. In regards to the side effects, though, I joined a mirtazapine Remeron Facebook group. These are great because you can actually talk to other people that have been through the same thing, similar things. And it is interesting how many people out there have been through this, and yet doctors, and a lot of doctors, don't know how affected some people are by these drugs. And so my naturopath, here's a really good example. I've got 2 different doctors that I'm working with right now. One is a GI digestive doctor, and I just started working with him in the middle of the withdrawal. Was our first actual meeting, was last week. And I've been working with a naturopath, and she's been on board for a couple of months. So she knows me before the Remeron. She doesn't know my normal, though, because I had all the SIBO stuff going on. But she knows me before the Remeron. So she knows what could be a withdrawal symptom versus what could be permanent damage or something specifically wrong with my gut. The GI doctor feels that there's no way that this could be withdrawal, that my gut is not emptying fast enough. So we are doing a study on that to see if I have gastroparesis. The naturopath, on the other hand, still feels like I'm still in withdrawal. I'm going to tell you, I still feel like I'm in withdrawal. I still get dizzy spells. I still get prickling of the skin. I still get weird stomach cramps, just random. So here, I want to show some of the side effects. So these are side effects of SSRIs. So decreased alertness, nausea, tooth decay, diabetes, inappropriate whatever hormone secretion, gastrointestinal bleeding, serotonin syndrome, suicidal feelings, whatever neuroleptic malignant syndrome, hypomania or mania, tricyclerides, antimuscarinic effects, tooth decay, decreased alertness, suicide, serotonin syndrome, diabetes. So this is small. This is not a very big list. MAOIs. So they all have very similar side effects. Here is a side effect of this syndrome. Holy crap. Blurred vision, confused, agitation, constipation, difficulty urinating, dry mouth, leading to tooth decay, erectile dysfunction, hallucinations, hot skin, decreased sweating, increased eye pressure, low blood pressure, nausea, feeling sick, rapid heartbeat, disturbed heart arrhythmia. And then look, so these are all websites that I came across that are not, so this is a UK website. So assessment of antidepressants. So a lot of these, focus, man. Sorry, my camera, I got a big scratch on the back end of the screen of my phone. And so the camera wants to focus in on the scratch and not on what I'm showing it. So there we go. All right, so this is a research study to determine the differences in the frequency and intensity of antidepressants induced side effects in patient treatment and primary care. So here are the results. Out of 508 patients, a significant problem, abdominal pain, 14% of subjects, indigestion by 19% of the subjects. So my GI doctor told me specifically that Remeron, and even his nurse, said, well, why can't you just reinstate it? Because there's a huge ton of the population that it helps with acid reflux. Well, look right here, 19% indigestion. No, not a huge percent. And actually it shows that a good percentage, it caused issues. Nausea, 15%. Oh, I did it again. Maybe I shouldn't put my finger in front of my camera because it's really angry. So let's try. I am so sorry. Aha! All right. Nausea, constipation, 11%. 29% is from sweating. Yeah, so yeah, I wake up in a pretty hot sweat. Suffered from sudden heat stroke, 20%. Holy crap, that's huge. 10% suffered from swelling. 23% reported suffering from dry mouth. So you're not alone. I mean, if you start having some issues on your antidepressants, I don't know. Sometimes they say, hey, just keep taking the antidepressant until it, subsides some of the side effects. And sometimes for some people it does. Quite honestly, though, I belong to a Facebook group for Remeron, mirtazapine, and which is fantastic and very helpful. I do think joining something like that would be very helpful, to be part of a group, to get other people's experiences, because you kind of feel like you're going crazy, and especially when you talk to your doctor and your doctor hasn't done They do research, they've been to school, that kind of thing, but they may not have run into a patient like you. So if you're having severe side effects, think about changing, switching, reducing. Talk to your doctor. Just be very honest about it. Because I wish I would have known, I would have stopped a lot sooner, and I would not have gone through half of the withdrawal that I'm going through right now. So there was a gal that just posted on this Facebook site that said, hey, I'm in week 3 of taking the mirtazapine Remeron, and I have horrible joint pain. Like, this is getting really bad, and I'm getting dizzy. What do I do? Man, go talk to your doctor. Like, don't let them shoo this issue off to the side and be like, oh yeah, it takes a little while to get used to it. No. I wish I would have known. I wish I would have gotten off of it sooner. I wish I would have done something different, because, withdrawing from opiates, 3 to 4 days. And you're feeling down, you're feeling like blah, but at least like the nausea kind of subsides after 3 or 4 days, 5 days. After a week, you can be down for a week. But when it comes to these, man, I'm on week 2. So this is some harsh stuff. It takes a minute. Anyways, like a nice little pie graph that I found that is like, okay, so these are on SSRIs, and I think this one is like, in general, SSRIs. So these are SSRI specific antidepressant patient reported side effects, world data. How many people? I think this is like 700 people. Yeah, 700 patients survey reported having experienced side effects. 38% surveyed reported experiencing 1 or more side effects. And then they give you this nice little deal. Sexual dysfunction, drowsiness, weight gain, dry mouth, insomnia, fatigue, nausea, dizziness, lightheaded, tremors, shaking of hands. But this is what I found interesting right here. So 40% somewhat bothersome, 19% very bothersome. So like the pie chart is bigger on the bothersome, hey, I'm having side effects, than it is on the I'm not doing so great. So when you get onto some of these forums and talk to other people, and this 1 or 2 people will post to you and they'll be like, oh yeah, no, I didn't experience any side effects. Like, I got off of it last week and I slept fine. Great for you. You are one of the 34% of people that it didn't affect negatively. 34%. Anyway, all right, let's go up here. Antidepressant withdrawal symptoms. So digestive issues. This is one, a lot of these websites do not give you a comprehensive breakdown of the withdrawal symptoms. So it took me actually a minute to find this website. This is Harvard Health. This is on like the 2nd or 3rd page of Google searching for like antidepressant withdrawals. Digestive system, nausea, vomiting, cramping, diarrhea, loss of appetite, blood vessel control. You may sweat excessively, flush, or find hot weather difficult. Sleep changes, trouble sleeping, unusual dreams, nightmares, balance, dizziness, lightheadedness, control of movements, tremors, restless leg, uneven gait, difficulty coordinating of speech and chewing movements, unwanted feelings, mood swings, agitated, anxious, manic, confused, strange sensations, pain, numbness, may become hypersensitive to things around you, a ringing in your ears, may experience brain zaps, feeling like resembles electric shock in your head. And as dire as these are, you shouldn't let them discourage you if you want to go on your antidepressant. Many of these symptoms of SSRI, of SRI discontinuation syndrome, can be minimized or prevented by gradually lowering or tapering the dose in the weeks or months. Here's two thoughts to chew on, and then I'll let you guys go. If you're having side effects already on your SSRI, your tricycloride, your whatever it is that you're taking for sleep, anxiety, depression, mood swings, whatever it is, tapering and looking at a month-long, year-long withdrawal when the side effects are already in place is daunting to think about. Hence the reason why I cold turkeyed and just walked away and said, you know what, I'm better off getting off of it right now than I am being on it. So there's that answer. But also, though, I understand there are some people out there, and for me, sleep, I am one of those people. So I'm not going to say there are some people out there, because I am one of those people. The issue, I was unable to get sleep because my stomach, I had constant pain in my stomach. And so in order to combat a lot of the anxiety I was having, because I was getting no sleep, which was causing anxiety, which was causing depression, the sleep was the main focus. And so I was one of those people where the side effects, even if I read this list of side effects, I would have at least been aware that, hey, this is what's happening to me, and I would have stopped it sooner. But I think I would have bypassed these and said, you know what, right now I need sleep, or it's going to kill me. Which, yeah, I think I would have, looked at these, read about these, and just continued with the medication to try to see if it would have worked for sleep. So just be careful, just be really, really, really well informed. I met a gal the other day that said that she reads through these lists, goes to multiple websites. That's the other thing. Don't go to one website. 20 websites all have like tiredness, dizziness, upset stomach. Look at like 20 different websites where they get a little more detailed in regards to the side effects and the withdrawal symptoms. Also, visit Facebook groups of people that are on that medication. Ask for their experience. And go to negative and positive Facebook groups. There's some that are negative, there's some that are positive. Go to a Facebook group where people are withdrawing from it. But really, if you have the ability to do that research before trying that drug, do your research. All right. Until next time.